So good evening and a warm welcome to all the dignitaries present here. I'm Sreshi from Planet, serving as the allocated session assistant to ensure a seamless experience. Planet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for doctors. It is with great pride that Planet serves as the digital partner for this event, hosted by the Indian Association of Preventive and Social Medicine. And the focus of today's session is 8 steps approach for designing a research proposal. So let's begin today's session, for which I'd like to invite Dr. Animas Jain sir to take over. Over to you, Animas sir. Kindly proceed with the topic.
Thank you. Thank you. So good evening, everyone, and welcome back to IAPP session of IAPSM Karnataka chapter. We are here yet again with another topic, another resource person, and we believe this will be very useful for you. So let me just hand over to Dr. Poonam, our President of Karnataka chapter of IAPSM, for her opening remarks, and then I will introduce the speaker and we'll go on to the session. Dr. Poonam, over to you.
Thank you, Dr. Animesh, and thank you, Learnet, once again for hosting this IAPP activity. A very good evening to one and all. So, as Dr. Animesh mentioned, we are with another important topic of academic importance for all the postgraduates, especially, and for the budding professionals in the field of community medicine, as well as in the other disciplines as well, because all of us know research is an integral component of medicine field these days. We all talk about evidence-based medicines and policies and decisions making to be taken based on different research and evidence. So, but many times we do have hiccups in initiating a research or taking it forward, or how to proceed and taking up the first step and its continuation as well. So I'm sure this particular topic would be of great importance and use for all the participants having assembled over here. I also, on behalf of IPSM Karnataka chapter, I welcome and thank our resource person, Dr. Avinash, for taking this session, and also thank Dr. Animesh for moderating the IPP activity. Thank you all, and have a fruitful learning.
Thank you, Dr. Poonam. So as we've been doing over the last couple of months now, so this, though we conduct it under the banner of IAPSM Karnataka, but the reach of this program is far and wide. And we are very happy to see that people have joined from many other parts of the country also. So welcome to you all. And we have a very interesting topic today. And this is very close to Dr. Avinash Kavi's heart, as I'm told. So he also is like very passionate about research, and then he also wanted to take up this topic so that he can spread the message of this 8-step approach to creating a research protocol. Before I go on to handing it over to him to take the session, let me just briefly introduce, though he has a lot of achievements and he has a huge CV, it was a task for me, about 28 pages of CV. But what I'll do is I'll briefly introduce him to you so that you get an idea of who our resource person is. So Dr. Kavi completed his MBBS from JNMC, which at that time was RGHS, under RGHS in 2010. Went on to complete his MD from JNMC, Belgaum itself, where he is a faculty currently as an associate professor. So he completed his MD again in 2014 from the same institute, and he was a first ranker at the KLE University at that time. And immediately followed it up with a DNB in social and preventive medicine. And there again, in 2015, he was the first ranker, President NB gold medal, he bagged it. And then he didn't stop there. So his quest for knowledge and pursuit for excellence continued. So he went on to do his WHO fellowship and training, fellowship training in entomology. He has a fellowship in diabetology from the Medversity and Apollo Hospital Group. And he has been very, very perseverant with research. So he's done lots of research. He's bagged multiple prizes, including best presentations. And he has 58 publications, which include some of the very prestigious journals from the Biomed Central Group, as well as Lancet, couple of them. So he has been publishing very, very voraciously. And I think he is an apt person for us today. He's also had many of the honors, as I told you already, like President NB, but other than that, He's also had honors of getting Dr. Rema Mohan Award at MDRF Chennai, which was for Best Research Proposal Presentation in 2012. He also was awarded as the Best Speaker and Best Team Award at KLE in 2014. Other than that, he's also had Sharana Shri Youth Award for Social Spiritual Work for the Society by Basava Kendra Shimoga. And he has also had another award called Basava Guru Karunya Award by the Chittaragi Sri Vijaya Mahendra Mahanteshwara Samsthan Mat Ilkal. Other than that, I think he has many other awards, but I want to mention about this particular which caught my attention: Emerging Aspirin Investigator Certificate of Commendation by International Aspirin Foundation London. That was in 2023. So these are some of the awards which I've highlighted. Other than that, he's had many other awards. He's a life member of many associations, including IMA, IAPSM, IPHA, and Research Society for Study of Diabetes in India, and National Academy of Medical Sciences. And his Scopus index, author index, that is that H index is 12. So is for the Web of Science. So as I had told you that he's published very voraciously and he keeps doing that. Other than that, he's also done some capacity building. He's also into some social service, and he's conducted a lot of radio programs, more than 40 radio programs. So he's very actively engaged and involved there also. So these are some of the things which I thought I will just introduce our speaker for today. I'm sure that we will have very fruitful learning experience and we will be enlightened by the end of his talk. So over to you, Dr. Avinash. I know that I have kept it very brief, but I didn't want to go in for very details. Over to you.
Yeah. Thank you, sir, for your kind introduction. That was actually, in fact, more. I wanted it much lesser. Thank you for the kind introduction. And I thank Dr. Naik, President of IAPSM Karnataka chapter, for having thought of this webinar series, and Dr. Asha for coordinating all these events. And of course, Dr. Jain, sir, for I think he is the overall backbone of this whole webinar series, as I learned from Dr. Asha. However, as we all know, that research has become the most essential component of any healthcare professional today. So I would like to take us through a journey of this, how to design the research proposal in a systematic manner based on one of the senior researcher of our times, Professor Bodgage, using his criteria and how to actually not only just go for a dissertation proposal, but actually go for a grant proposal, how to go about. So probably the postgraduates will be benefiting this definitely, but also our contemporary faculty also who are interested in writing grant proposal, especially now ICMR is coming up with so many intramural, extramural grant proposal advertisements. So in that background, I think we can discuss some of the aspect. I'm very sure that I'm not talking something very great or very new thing, because most of the senior faculty here will definitely agree to that. But only thing is I'm trying to put it in a systematic manner so that we don't miss anything. That is what is the overall intention of this discussion. So if I can share my screen. Yeah. Am I audible? First of all, am I audible, and are my slides?
You are audible, Dr. Kavi, and then your slides are visible. Right
and
now,
moving,
you are
sir?
moving between the title and the objective. So,
okay,
yeah.
sir. Fine, sir. Okay. So, as mentioned already, for the next couple of minutes, we will just go through this 8 steps approach to design a research study. At the end of this session, the participants will be oriented towards the research methodology, which most of us are already in, but will also learn this 8 steps approach to design a research project proposal. Most of us have already thought and already have written many of the research proposals. And probably we might have already carried out different steps in writing, because every university or every grant mechanism have their own protocol of how to design, how to write a research proposal. But what is followed internationally is this 8 steps approach, which is very commonly practiced. So basically, when we look into this field of medicine, every day in our day-to-day practice of clinical medicine, preventive medicine, or public health, we come across many such questions of which we need to answer so that we can find a way towards the truth. And the quest of the researcher will continue until he or she finds an answer for many such questions that we incur in a day-to-day practice. Whenever we talk about the research, every day and day in and day out, we are just talking about a thing called as evidence-based medicine. And we all know that we are in an era of evidence-based medicine. What exactly is the meaning of an evidence? And most of the postgraduates or young faculty are generally try to ask this question: why do we actually need research? Is it not just enough that we take up our daily day-to-day task, whatever has been assigned to us? Why we should break our head, burn our blood by doing this research? And the most important thing, is it necessary for an undergraduate or a postgraduate training? Most of the institutes, for example, some of the reputed institutes at the national level, Institution of National Importance, Institute of Eminence, deemed universities have made it like a mandatory component of having as a value-added course for some undergraduate program. And a postgraduate training, it is an essential component because they have to do their dissertation. And we all know that dissertation is a systematic training in the research methodology. But at the same time, we encourage our postgraduates, undergraduates to present their research findings in many of the conferences. So all these things somewhere and around, it revolves around the research. And whenever we talk about evidence, so today, whatever we practice are all based on the evidence which has been generated over a period of years. When we open any textbooks, each and every sentence of the textbook has been evolved by some research done by some great researchers. And we see a list of bibliography at the end of each chapters. So if they had not done those research, definitely we would have not got that evidence. And for that, generating evidence, we have to do research. So the objectives of an institute is not just to have healthcare professionals out of the institute once they finish their course, but also budding researchers, so that we are not here to just read the evidence which has been generated over a period of time, but we have to evolve with newer evidence because we are in the evidence-based medicine era. So, as we all know that research is nothing but an art of scientific investigation and a systematic search for truth. And that systematic search has a scientific basis. We always highlight the knowledge gap that we see, and that knowledge gap has to be delineated in our research proposals and provides evidence to the facts that we are already knowing or what is coming in the near future, and test or generate a generalizable theory, because all these, most of the treatment, whatever we are assuming, or the public health policies are based on the theories that has been evolved, and we have tested those theories to near possible truth. And this is the basis for the practice of evidence-based medicine. And of course, with all these things, so our idea of research should be with the focus of generating this kind of evidence. So I'll start with this very important but a very interesting aspect. What Professor Bodgage wrote few years ago, I think in 2001 this was published. What are the reasons why our papers get rejected from most of the journals. We all know, as a part of generating evidence, as the first step of evidence-based medicine is publishing our research in a reputed indexed journal. But often we feel disheartened after seeing the comments and the rejection by the editor. But what are the reasons why it is being rejected? These are some of the reasons which we can quote. It can be of inappropriate or incomplete statistics, over interpretation of the results, inappropriate or suboptimal instrumentation, sample size not adequate or biased, or insufficient problem statement, inaccurate or inconsistent data that is being reported, incomplete or inaccurate or outdated review of literature, and defective data that is being presented. So these are some of the reasons which we can put, and the list goes on, and we can talk about these things in detail if at all in case if it is needed. But anyways, I've given the reference. Anybody can, who are interested, can read this very interesting paper of rejecting the paper. Probably this will help us refining where are we missing the link. But in this journey of rejecting the paper till the paper getting accepted, everything revolves around how well our research proposal has been designed. So if we follow this 8 steps approach, probably we are going in a right path in designing a better research proposal. Why do we need these 8 steps? That is what is the first question that we can put. Definitely it is a systematic approach, as I've been mentioned. This is 8 steps where we try to answer 28 questions which help us keeping track of all the crucial elements of the study process. And this is what ensures the quality of the study, which in turn has an implication over the validity of the results that we are presenting. And of course, this was conceptualized and published by Professor Georges Bordgage from the Department of Medical Education, University of Illinois at Chicago. So with regards to Professor Bordgage, I would go to the 8 steps approach of designing the research 28 research question. Of course, we have that published in 2003 in the Medical Education Journal. So these are the 8 steps. Transform the idea into a research question, which has 9 questions to be answered, and select the instrumentation, select the best study design which is applicable, select the statistics, determine the sample size and sampling, monitor the data quality, and set timetable and budget, and finally write the grant proposal. So under these 8 steps, we have 28 questions. So anyway, however, we are going into the details of each of these steps. So we can go about in doing that. So first thing is research question. Most of the times, whenever we discuss what are the topics of your interest, most of the times the postgraduates may come up with some topic, or sometimes they may ask the faculty themselves to suggest a topic, or faculty have already decided what is the topic that has to be given. This is one aspect when designing a dissertation for a postgraduate. But when it comes to writing a grant proposal, for example, ICMR, now there was a call for intramural grants or extramural grants writing. So what is that we need to focus? Because ICMR had given a list of topics or whichever are their interest, and they had specifically noted down some topics which are of their interest. So now whenever we are selecting this topic of interest, of course, it is a topic which we are interested, definitely, but also we should make sure that topic is of interest, of a national interest, if it is of ICMR, or if it is of interest, of particular interest to a particular grant agency. So pick a topic of interest. So I'll just try to see, I can balance both these things, or else I'll try to focus more for postgraduates, because most of the attendees are the postgraduates. Whenever how to transform an idea into research question. So first we'll start with the topic of interest, and next we will try to narrow the topic focused and list out some potential questions related to that, and then pick up one question and try to refine that question. So basically the uncertainty about something in the population that as an investigator wants to resolve by making measurements about that particular aspect using a particular study subjects. That is what is all about in formulating a research question. So suppose if I want to design, if I want to know there is a huge problem of preterm birth rate. Whenever the preterm birth rate is so high, and even now India Newborn Action Plan is also targeting the single digit stillborn rate and early neonatal mortality. So we know that preterm birth is very common for both of these. So whenever there is preterm birth, there is a chance early onset labor, the chance of fresh stillbirth is more, and early neonatal mortality is also on the higher side. So considering these two, definitely preterm birth should be my topic of interest. But if I want to do some intervention related to that, there are a lot of published literature available. One which caught my attention was aspirin. Aspirin is a known medication for more than a century by now, and it has been used as an anti-inflammatory agent. So can we relate aspirin and preterm birth? As we know, the etiology, one of the etiological hypotheses for preterm birth is the inflammation which is setting at during the time of placentation. So early intervention using aspirin, can it reduce a preterm birth, is the hypothesis that I am like to form. That is how the research question from a topic of interest to the focus to a list of questions. Of course, there are a lot of questions that I can put on, finally refining the question. This is how we can progress. So from idea to research question, so there are 9 questions that we need to answer. What is the topic of the study? What has been already been done before, the literature, and what is the outcome that I want to achieve in this study, and what is the intervention? Are we looking at the difference or are we looking at an association? Who is the population to apply this result, and what is the specific research question? What is the expected answer, which is nothing but the hypothesis, and why do this study, the relevance? So if I can answer all these questions, my research question is ready. As I already mentioned, the topic is preterm birth. What has been done? The literature review. What is the outcome? Can I do some intervention to reduce the rate of preterm birth to 10%, 20%, depending on the effect size that I can decide? And what is the intervention is the aspirin, which I just gave an example. Are we looking at a difference? Yes, definitely. As compared to placebo, aspirin group, if there is any reduction in the preterm birth rate. And the population, of course, it is related to pregnancy, so we can apply it to pregnant women. But is it generally for all pregnant women or a high-risk woman or any other population? So that we can decide. So in consultation of obstetric researchers, as well as the literature review suggests either we can go with the nulliparous population, or we can go with the previous preterm birth, or we can go with generally all pregnant women. Let's see how we can go with that with a particular research question to apply. And what is the specific research question? So will low dose aspirin actually reduce the preterm birth as compared to placebo in a particular group of pregnant women? Say, for example, I'll choose nulliparous pregnant women because they are naive population and they have not been exposed to any kind of interventions for pregnancy related conditions. What is the expected answer? Definitely, I will say that I can reduce using this intervention. Say I can propose that I can 20% reduction in preterm birth rate. That is what I would like to achieve. Why do this study? It is relevance. It is not only relevant to me, but also clinically relevant. Till date, we don't have any answer for the preterm birth. We don't have any intervention for preterm birth. At the same time, it is of national relevance because India and also at the globally, we also have every newborn action plan or India newborn action plan, and government of India, including ICMR, is striving hard to reduce this early neonatal mortality and thereby reducing infant mortality rate. So that is how we come across in refining a question for, that is the first step in formulating any research proposal. At the same time, we need to ensure some 5 important aspects in the research question what is the outcome. So the operational outcome should not be too broad or vague, but at the same time mentioning what is optimal. Of course, this is based on the literature review. At the same time, what is the intervention that we are planning? Are we looking at the difference or an association? Who is the population of interest? And in the context of the theory, that research question has to be formulated. So to arrive at the research question, I would like to tell you that you can you can use this funnel approach. So this funneling approach starts with the broader aspect of the topic, then working knowledge, then depending on various questions and finalizing one question and refining it and arriving at one strong research question, which will be the first step of designing the research proposal. So this kind of funneling approach can be helpful for this research proposal design. Step 2 is the instrumentation. Of course, we all know how are we going to collect the data is based on the your questionnaire. So are we going to design a separate independent questionnaire, or are we modifying the existing instrument? For example, I'll give a different example. If you want to undertake a research on measuring the various indices related to postpartum depression, there are already existing lot of instruments related to that. Like we have Edinburgh postnatal depression scale. At the same time, we have PHQ scale and other things. Or if you want to modify in that, and if you want to develop a newer one, you are most welcome, but it has to be validated before we actually start using that instrument. So that is what is the instrumentation. The most important aspect is what data we are supposed to collect to ensure the outcome. See, whenever we decide to collect the data, we always think that we should collect more data so that we can have more information, so that we can have more papers. That is one type of thinking. But otherwise, we should always be very specific to what exactly we need, because that will decide the quality of the data being collected. Otherwise, if we collect each and every aspect of whatever the condition is, it will be totally diluted and it will lose its relevance as we progress in the data collection. So that is what is exactly important. And if at all you are using any scores, what are the psychometric qualities of the scores? That has to be ensured based on the previous published literature or the validity assessment. Step 3 is to assess and accept the best study design. So to select the best study design, we always have to look at these 4 questions. One is, are we observing things and not intervening at any time, or are we doing any intervention to change the course of the outcome? So that is the first question that will answer, that will decide which type of study design that we are in. And we should also look at, do we actually need a control group? Sometimes whenever either it may be a placebo, or when comparing with the standard of care, we need a control group. Whenever we don't have a control group, then comparison becomes difficult. So that depends on the type of research question that we have developed. And how do we actually control for the confounding variables? That is most important, which will have a strong internal validity for the confounding factors if we don't address at the time of designing. And what best study design answers the question that we have formulated. If at all if you want to see what is the burden of a disease, what is the prevalence of a disease, of course we can go with the cross-sectional one. Otherwise, if you want to see the risk factors and how the risk factors are associated to the outcomes, we can go for analytical studies. If you want to intervene and change the course of an outcome so that you are proposing a newer method of treatment variable or an intervention of public health importance, we can go for a controlled randomized trials or non-randomized trials for that matter. Most of us have this habit. I don't know. I'm basically thinking about the postgraduates, and I'm telling that how to choose this best study designs. That is what I was telling. If you want to know the prevalence and know the best diagnostic test cross-section study, want to know the association between the risk factors and disease, we can go for analytical studies and want to know the difference between the effect or treatment, we have the RCTs. Most of us think that RCTs are great and cross-section studies are very low in nature, or most of people think that other way also, randomized control trial are very superior or very difficult to do. Let's not go into that. As a postgraduate, we should be happy with the observational studies or maximum up to case control studies and other. These are some of the inhibitions which we see in our whenever we interact with the postgraduate students. But one thing we should always remember, it is not, we should never assign the study design first and then go on searching for the research question. Research question has to be formulated according to the answer or the hypothesis that is expected out of that research question. That research study design which will answer the research question, that has to be chosen automatically. So whenever we talk about any research study design, every level, of course, we know the levels of hierarchy of level of evidence. When we talk about the hierarchy of level of evidence, starting with the preclinical studies to the case report, to the cross-sectional, to the case control, to cohort, to RCT, to meta-analysis, and then finally coming into the practice or guidelines. So all this has been based over a particular system of study designs that we adopted or evolved over a period of time. If we don't have the preclinical studies, nothing it can be progressed in terms of any therapeutics. So every study design have their own importance. Please remember, study design is based on the type of research question that we have been formulating, and the scientific level of research, hierarchy of level of evidence, whatever it has been described in this slide, that only shows that how these study designs have been kept on a hierarchical level. Nothing like to tell that RCTs are superior over case control studies, nothing of that sort. It is definitely the study designs which have been the basis on as a foundation, which has led to the finally to this practice or clinical practice or guidelines. Step 4 is the statistics. So this is one of the most important thing that we always fail to answer, because we have very few people who are really good at statistics, because probably most of us, some of us at least, including me, we were not, somehow the mathematics was not very much comfortable to us. That is why we landed up in medicine, and ultimately statistics is haunting us in spite of us running away from mathematics or the numbers are again back to us. So here it is not just about the numbers. Basically, any research study, we will have an outcome in terms of percentage or in terms of mean, standard deviations and other things. But if you want to tell the best thing out of it, if you want to suggest the best outcome or the results out of it, we need to say which statistics that is best applicable to answer that particular question. So the hypothesis, the designing and the variables, everything, which statistics fits it. So that depends on the number and type of variables, the relationship that we use between the variables, and of course the study design that we have chosen. So statistician, of course, we all approach our statistician, though we have certain basic knowledge of statistics, it is always imperative to have the opinion of the statistician as well. And statistician, we should be ready with these things. What is the question that we have? What is the hypothesis or whatever we are looking? Either we are looking at difference or an association. What is the study design that we have selected? And what are the variables are counted or measured, the variables that we are using? With all these things, I think statistician will be able to help you out in designing which best statistic will be applicable for the data that we are generating. So if there is a difference, this is just an overall overview of how to go about it. Of course, we had some weeks ago, I think we had a separate session by Dr. Asha about choosing a best statistical test. I think most of us can refer that as well. That has been very clearly mentioned in that webinar too. So just to give an overview, if there is a difference, what is the type of data that we are having either nominal, then we can go for chi-square. If it is interval or ratio, looking at the distribution, we can go and choose the t-test or the Wilcoxon test. And if there is an association that we are checking, if there is a nominal, then again chi-square test to a certain extent. If it is an interval or ratio, if it is normally or non-normal distributed, we can choose either the Pearson's or the Spearman correlation. Then coming to the subject and the sample. So most of the times we think that whoever comes into our contact will be our subjects, but it is not so. We have to have a very systematic approach before we actually select the sample, because they are the ones who are giving the data for the results and the outcomes that we are measuring. So here we have some 4 questions that need to be answered. What is the criteria for inclusion and exclusion of the study subjects, and how to obtain the study subjects, how to assign the subjects if it is an experimental group, and how many subjects are needed. That is nothing but your sample size. Whenever we talk about the criteria, the inclusion and exclusion, so that should depend anything that basically we are trying to avoid the confounding variables here by having a strict inclusion exclusion. And that inclusion exclusion should not be so strict so that you will not get any sample. So it has to be a balance of both. That is what is necessary and which is actually practiced. And most of the times we are also having a habit of writing the exclusion even when we don't have anything. The opposite of inclusion in the exclusion criteria, which is not accepted. It is not necessary, in fact. That is one thing. Secondly, if they don't give consent, that cannot be an exclusion criteria. Of course, it is as an ethical part, we are excluding them as a part of the study. We need not mention that in the exclusion criteria. Strictly in the exclusion criteria, we have to be focused on the confounding variables which have a direct effect on the outcomes of interest. In the inclusion, we are very much specific about the target population that we are actually trying to collect the data. That is what is the overview of the inclusion exclusion and how to obtain these subjects. So either we are searching for the subjects in the community, in a field practice area, in the hospitals. That has to be decided based on the research question, and how to assign the subject if it is an experiment. So that is what is the heart of this control trials, what we call it as randomization. How do we actually go about randomization? There are different methods of randomization that can be adopted. And most important is the sample size. Most of the times, whenever it comes to the dissertation proper, we think that a sample size of optimally, what is the necessary sample size? Sometimes we calculate the sample size, or sometimes we do a study and then go back retrospectively and try to adjust the sample size. Both are not accepted. So we have to go in a systematic manner with the proper data which is needed based on the previous systematic reviews or the published literature. Based on that, we can actually go about how many subjects can we actually recruit into the study. The 2 important aspects that we need to give attention is have enough subject to detect the difference, if the difference really exists. Please note that it should be enough to detect a difference. So that means that it should not be too large also, so that it's not necessary or it is just a waste of resources, time and energy. So that is one thing we need to keep in mind. And it should not be too less also. If it is too less, of course, we cannot achieve the validity of the results that we are actually presenting. So adequate sample size is large enough, should be large enough to control the random error, but also a representative enough to control the systematic error. Too many can lead to trivial results, and too less may be unethical or sometimes invalid. So these things have to be kept in mind. So it is always necessary that we talk and have a detailed discussion with the statistician or whoever knows what is how to go about the sample size calculation, what are the parameters that we can actually use for calculation of the sample size. So that will actually help us in obtaining an adequate number of sample size. So this sample is a representative of the target population. So basically, these 3 terminologies are very often used but often confused by most of us. So who is the target population? Who is the sampled population, and what is the sample? The target population is to whom the study results are applied. So, and the sample population is where the study subjects are selected, and the sample is the actual people or the persons, participants who take part into the study. So basically, sample should be a representative of the target population, and the sampled population is where we go on searching these sample so that it can be a field practice area and also a designated study hospitals that we choose to have in our study, in our team, in a research proposal. So when it comes to sample size, we adopt different methods. We have formulas for that. I'll not go into the details. Since I had started with an example of preterm birth, so how to go about estimating the sample and estimating the power to have adequate sample size for one of the trial that we had just completed, that is the aspirin trial. So the risk of preterm birth in untreated nulliparous women was 8% as per the previously conducted EAGER trial. That was what the literature review suggested. When we looked at the preterm birth rates, our own global network data told that it is ranging between 2.9 to 9.8% across 3 continents and 8 countries that currently the global network maternal newborn health registry is functioning. At the same time, we have WHO estimates from these global network countries, which the ranges is between 7.7 to 6.7%. So definitely, we have a huge burden of preterm birth. So that itself is a relevant, one is this study is relevant, and to say it is really important to address this issue. At the same time, what we took was 8% was a conservative estimate based on the previously conducted studies and these estimates which has been provided. And based on that, for each of the rates, they finally went on having a different power. For power of 80% and power of 90%, we calculated at different rates. So considering 8%, finally, we finalized this sample size of 3,400 sample per group, or if it is 25% reduction, that is effect size. If it is 20% reduction, 5,800 was a sample size required. So finally, we selected and went on with this 5,483. So statistician will give all possible sample sizes depending on your effect size, depending on the percentage reduction, is what is effect which we want, and what is the actual rate of preterm birth rate, that is what we have considered. So considering the minimum rate of 8%, so what we selected was 5,483. So the sample size was estimated based on that, and researchers and the investigators can sit through and decide depending on the funding and other aspects to select which is the best sample size to answer this particular research question. I'm talking about the grant proposal. Similarly, postgraduates can definitely sit through this data and finally decide with your guide to design a better research proposal and a better sample size estimates. Next, coming to the 6th step, that is the data quality and the quality control. How are we going to collect the data? And people will say it is very simple. We'll just go, we'll ask the people to give the information. And if possible, if somebody is doing it in a genuine way, they'll even ask for informed consent and other thing. But it is not just enough that we collect the data. Today, we are postgraduates. We have sample size might be 100, 200, 300, 400. We might get time to do all those things. We might have got a day off for collecting the data and so on and so forth. So we may do that. But in future, you will not be collecting data on your own. You will be training people to collect the data. So in that time, how are we going to collect the data? How these people are going to collect the data, and how do we monitor the quality of the data that is being collected? Is it just enough, whatever they have filled, is it correct? So what we do is we just try to compare there is between the forms and between the data, and if there is any source document, if there is any check that can be kept to monitor the data quality. That has to be ensured whenever we collect the data. Please be sure that quality control is the most important and essential element of the data collection. A very well-designed study can fail if we don't look at the quality control. So even for the best of the programs, they have the quality control, because if we don't ensure the quality, the whole data will be of useless. So whenever we talk about the data collection, it involves 4 aspects. What is the task that has to be performed? It is just an interview. Does it involve any measurements? Does it involve any sample collection? And how to go about the collecting and processing of the sample and finally getting the results of that? And if at all we are having all these things in place, who are the persons who are needed? If it was only interviewer, that is different. If we want to collect the sample, we need a technician help, and we need a lab support, a laboratory person, or pathology or the biochemistry people to have the results of it. And we cannot go on and on in collecting the data. There has to be a timeline where we are collecting and where we are collecting this data. Because if at all we are collecting this data at home, some things can be done at home. If you are collecting the sample, it may be difficult to be done at home. So then you have to do it at the primary health center or a community health center or in the hospital. So the task to be performed, the person needed, the timeline and the place is very important for the data collection. The data quality has to be ensured under the consistent condition. These measurements has to be done. Whoever does it has to be done in a consistent manner. And that has to be ensured whenever we are collecting the data collection form. And how do we go about that? Will start with the pilot test of the data collection form too. So in the pilot test, it will give us a rough overview of how this data quality would be affected in future, so that appropriate modifications can be taken care at the time of pilot itself. The next step, the timetable and the budget. Probably the timetable till here we can expect for a postgraduate, and if at all, now most of the institutes like ICMR are also funding for a postgraduate dissertation, and also they are funding for some small projects also. At the same time, most of the institutions, like most of the universities and some research organizations are also funding some short proposals. So there, all these things become important. Though it may not be very much relevant, of course it is relevant. The timetable is relevant for our postgraduate dissertation too, because we have to finish in a particular timeline, because otherwise you will not be eligible to write the exam. At the same time, but when it comes to the actual timetable, that what we are referring to is the schedule that we have to follow if we are applying our proposal to any granting agency. So what is the timetable of their organization? We have to adhere to that schedule. Who will be doing what? Because it is not just doing research. Science is an easiest part. Whenever, based on the experience of our seniors and my personal experience, what I feel, science is the easiest part in the research, but managing personnel, managing the finance, managing the HRD is the most difficult task in any research proposal, in organizing any research study. And what equipment do we need? Because that will decide the cost to a greater extent. Because printing the forms and other things may not take much, but if you are using any equipment for a study, the cost will escalate in a greater proportion. And how much will it cost is the actual budget that we are actually going for. So this is the Gantt chart. Most of us might be aware of it, which will give us a bird's eye view of the time duration required. Most of the times we always think that data collection is what we are, the actual data, the study that is we are planning. But actually we need to know that the study starts with the planning till the completion of the data collection, and also the analysis, and also your publication. So we have to have a strict timeline, and we have to adhere to this timeline. That is most important. The budget has to be planned in for the initial preparation. We often forget to plan for initial preparation, and most of the times researchers get disheartened because a lot of money will be spent in the initial preparation. Pilot testing, data collection, analysis, and dissemination of results, including presentation and that of publication. And finally, the last step is to write the grant proposal. So having the proposal, how will you keep a track of the study, including the schedule, the personnel, and budget? So what we have here is an implementation plan. Every study, they have a protocol of how the study progresses. But at the same time, at every step, how are we going to implement? Suppose if we are going to have a longitudinal study where we are having 2 to 3 follow-up, how are we going to plan that follow-up? In how many months we need to collect the data of the first follow-up, and the same people we have to go for second follow-up, and what are the chances of attrition? Everything has to be kept in mind whenever we are writing the grant proposal. That is what is the implementation plan. And finally, what is the granting agency's interest, and what forms and application process that we have to follow. That depends on the funding agency and the institutional requirements. Every university have their own requirements, and also the agencies. So the 8 steps are, I'll just to recapitulate what we have discussed so far. Transform the idea into a question and select the instrumentation, the study design, the statistic, sample size and the sampling method, the data quality monitoring, setting the timetable, and budgeting the whole process, and finally writing the grant proposal. Finally, the detailed research protocol helps in writing grant proposal well, the abstract for any application well, and finally to write an article for the publication. So I started with reasons for rejecting a paper, to now we will come the reasons why the paper gets accepted, if it is important, timely, relevant, critical, and addressing a prevalent program. If it should be a well-written manuscript, not just well-written in terms of language, but it should be clear. It should tell a clear, logical story. Every paper should tell a clear, logical story. The chances of accepting becomes more higher. It should be a well-designed study, of course, following these 8 steps. Thoughtful, focused, up-to-date review of literature, because we see some of the review of literature are outdated. And after that, we might have missed the link and forgot to include the recent review of literature, which has a totally different outcomes altogether. And sample size sufficiently large, practically with useful implication, and interpretation looks into account, including the limitations of study, because no study is 100% perfect, including most of the well-funded research projects also. So if we can mention all these things and make sure that we take care of these aspects, probably the chances of accepting the paper will be much more higher. So, but everything relies on the way the study design is, the study proposal is written, executed, and finally obtaining the optimal outcomes. So that is what is this 8 steps is all about. So in summary, the research question and study design are the most important component that we need to look into. The outcome of interest dictate the instrumentation and not the other way around. And statistical consultation is definitely a wise investment. And as I mentioned, too few or too many gives erroneous conclusions. And study design and grant writing requires time and much iteration and consulting professionals. So we should plan ahead before we actually step into any of this research outcomes. So coming to now, it is NMC. NMC has come up with many online research methods. This was a online course. There was a notification, and most of you must be aware that Swayam portal of Government of India, now even ICMR, NI, National Institute of Epidemiology, has come up with a lot of courses. And one such which has been mandatory for postgraduates is the basic level course in health research fundamentals. And I think most of us are already been doing or already have completed that. And so many other things are also there, which are, if you are interested, then even our association, that is Indian Association of Preventive and Social Medicine, definitely can help us in getting through the research proposals in a rightful manner, and so that it will be a very useful outcome. So with this, I sincerely thank the entire Karnataka chapter of IAPSM for having considered this small attempt to just giving you an overview. As I mentioned in the beginning itself, I have nothing told, nothing new thing. Only thing I've just kept it in a systematic manner so that it would be helpful not only in writing the proposal well, but also trying to get the grant as early as possible and also go ahead with our research journey. And I thank the organizers, especially Dr. Naik and Dr. Jain and Dr. Asha for coordinating this. And I'll be happy if there are any questions related to that. Thank you, one and all.
So thank you, Dr. Avinash. I have put up a message sometime back while you were about to end. I haven't seen any question in the chat as yet. So before we get the questions, let me just again confirm with you, though I think I heard you mention. So can we advise the postgraduates who are doing their dissertations also to try and follow this method?
Definitely, sir. What we have been doing that in our institute we have a 2 days research methodology workshop. So basically this we have that is compulsory, mandatory for all the postgraduates, irrespective of the subjects they are. Basically, we conduct in 2 phases. One is soon after they join their course, within a month, when they have the preliminary discussion with their respective guides and they come up with an idea. So they will attend this workshop in identifying that the research question and finally converting into a proposal. That is the first step, which will happen over a period of 2 to 3 days. Then following that, they will submit the proposal and other things. In the second year, there'll be a follow-up workshop also regarding the higher level of going for a grant application and applying for some agencies for getting some grants for their, not only for dissertation, but also short proposals as well. So that is what has been an integral part of the postgraduate training in at JNMC for many years now.
No, that's quite a good idea to do. I think some of the places they're doing that. Even we have something like that. So, and now we've had follow-up workshops and all, I think from this year, last year or this year. So that's a very good idea, because at least what happens is they also get familiar with this and they can later take up their own projects and they can write proposals and things like that. So that's a good idea. Dr. Poonam, you want to ask or add anything further?
No, I would just like to compliment and thank Dr. Avinash. That was a very useful session for all. So I'm sure for the postgraduates would be of great importance. And I also thank Dr. Animesh for having moderating this IPP webinar, and also thank Dr. Asha for coordinating the activities. Thank you.
Yeah, in fact, Dr. Asha has done all the coordination this time, and then she has done all the background work, liaising with Dr. Kavi, getting the flyer ready, the message ready. So I have just been here today because I was a bit tied up with multiple things, but she's been very supportive, very helpful. So as usual, she is one person who's supporting us. Okay. Okay, somebody is asking, is there a recording available? Yes, all the recordings are available of all the webinars that we do for IAPP Karnataka. It's on the IAPSM Karnataka chapter's YouTube channel. So you will be able to get it. Though this was a direct message, but I want to just share it with everybody that all these webinars, within 2 to 3 days, we put it up on the IAPSM Karnataka chapter's YouTube channel. So please follow there and then you will get. So this is for everybody, whoever wants to again revisit or maybe share it with some other people who missed it, you could do that. Right. So I think since there are no further questions, I believe that you've been crystal clear, Dr. Avinash, and then it's been very useful for everybody. So I think on that note, let's call it the end. And thank you so much for being with us and sharing your expertise and the knowledge. We come back again soon, shortly, with another episode of IAPP. We have 1 or 2 very good resource persons lined up already. So we will come back with this kind of a session again. So thank you, everyone. Take care. Goodbye from here.
Thank you, Dr. Avinash.
Thank
Thank you, Avinash.
Thank you, sir. Thank you, ma'am.
Thank you. Thank you. Thank you all.
Thank you so much, everyone. Thank you so much for giving us the
Thank you,
opportunity.
Planet team.
Thank you, ma'am.
Planet.
Thank you.
Thank you.
Thank you, ma'am.
Have a nice day.
Thank you all. Thank you.
Thank you, Dr. Asha, for putting that up.
Oh, thank you, sir.